There's a moment that happens in almost every family. A phone call, a fall in the bathroom, a pile of unopened mail that turns out to be unpaid bills. And in that moment, the question everyone has been avoiding finally gets asked out loud. Can mom, can dad still live on their own? Most people think the answer comes down to health. Strong heart, clear mind, steady legs. But the families who navigate this well have learned something the rest haven't. Independence in your 60s, 70s, and 80s isn't a single thing you either have or lose. It's a system. A system built from 3 pillars that don't get nearly enough attention. The house you live in, the money you've planned for, and the body you maintain. Get those 3 right, and independence stops being a hope. It becomes something you actually built. This is the blueprint. Start with the home. Because the home is where most independence is actually lost. Not in a hospital. In a hallway, at 2 in the morning, on the way to the bathroom. For decades, the only answer to, what if something happens at home, was a panic button worn around the neck. Useful, but reactive. It tells someone after the fall happens. The technology now sitting quietly in ordinary homes is built to notice something before the fall. Or at least catch it the moment it happens. The shift is voice. Devices like Amazon Alexa and Google Nest have moved well past playing music. They're now wired into emergency response systems, medication reminders, and lighting controls, and they're built to be operated entirely by speaking, with no app, no menu, nothing to squint at. That matters more than it sounds. The biggest barrier to home technology for older adults has never really been the technology itself. It's been the interface. A device that responds to turn on the kitchen light removes that barrier completely. Then there's the part nobody thinks about until it happens. Motion. Sensors that track unusual inactivity, like a person who hasn't moved through the kitchen by 10 in the morning when they always do. Combined with smart lighting that automatically lights a path to the bathroom at night, address the single most common and most dangerous event in a senior household. The nighttime fall caused by a dark hallway and an unfamiliar step. Security follows the same logic. Smart locks, doorbell cameras, and remote monitoring don't just protect against intruders. They let an adult child living 3 states away check a phone and know the door is locked, the porch light is on, and nothing's out of place. Peace of mind flowing in both directions. None of this requires an electrician. The defining feature of this generation of devices is that they're plug and play, with no wiring and no professional installation needed, and the physical design has finally caught up to the user. Larger buttons, simpler interfaces, voice as the default, not the backup. Devices built so that declining vision, hearing, or dexterity isn't a disqualifier. The home, in other words, can now do something it never could before. It can pay attention, and a house that pays attention is a house that lets you stay in it. Here's where most healthy aging conversations go quiet, and it's exactly where they shouldn't. Start with the baseline, because almost nobody has it straight. Medicare comes in parts, and each part does a specific job. Part A handles hospital stays, skilled nursing, hospice, and some home health care. And for most people, there's no monthly premium because it was already paid for through payroll taxes over a working lifetime. But Part A isn't free at the point of use. The 2026 inpatient hospital deductible sits at $1,736 per benefit period. That's the number that catches people off guard in the waiting room. Part B is the one that costs every month for everything else. Doctor visits, outpatient care, durable medical equipment. In 2026, the standard premium is $202.90 a month with a $283 annual deductible. After that deductible, Medicare covers 80% of the approved cost. The other 20% is yours, with no cap built into original Medicare. That 20% on something like a hospitalization can add up to a number with 4 digits. Part D, the prescription drug coverage, runs through private insurers, each with its own premium and copays. The one piece of genuinely good news in the whole system is that recent legislation gave Part D a hard annual out-of-pocket cap. Once a person reaches that ceiling in covered drug spending, the rest of the year's medications cost nothing. That single change has quietly protected more retirees from financial trouble than almost any other Medicare reform in years. So that's Medicare, explained the way it should have been explained from the start. A for hospital, B for everything else medical, D for drugs, and a Part C option that bundles A and B into a private plan. Now for the part that actually catches families off guard. Medicare was never built to cover everything, and it doesn't pretend to. It covers somewhere around 60% of total healthcare expenses for the people on it. Routine dental work, dentures, eyeglasses, and hearing aids, the things that become more necessary, not less, with age, fall almost entirely outside original Medicare. If you've ever wondered why a hearing aid costs thousands of dollars out of pocket for someone with good Medicare coverage, that's the answer. It was never in scope to begin with. Stack the premiums, the deductibles, and the gaps together, and the long-range numbers get serious. Industry estimates put the lifetime healthcare cost for a single 65-year-old retiring today at roughly $172,500. And that figure excludes long-term care entirely. For a couple expecting a 25-year retirement, total healthcare spending is commonly projected near $600,000. Year to year, that often works out to something like $3,000 in annual out-of-pocket costs for someone relying on Medicare alone, before counting dental, vision, or hearing. This isn't a reason to panic. It's a reason to plan early, the same way you'd plan for a mortgage instead of discovering the payment the week it's due. Supplemental coverage, dedicated health savings, and an honest accounting of what Medicare won't touch, long-term care chief among them, are what separate a retirement that absorbs a bad health year from one that gets derailed by it. Financial independence, in this context, isn't really about being wealthy. It's about not being surprised. The third pillar is the one people associate with aging the most, and it's also the one where small, almost trivial changes produce the biggest results. Take gardening. It sounds like a hobby story dropped into a health video, but it's actually a useful case study in how arthritis and joint pain quietly push people out of activities that keep them strong, social, and outdoors, and how a few specific design choices can hand that activity back. The core problem with a standard garden trowel is the wrist. A traditional handle forces a twisting, downward grip that loads exactly the joint's arthritis attacks first. The fix is mechanical, not medical. Trowels and tools with handles that rise vertically keep the wrist in a neutral, untwisted position, and grips with a thicker diameter, research points to roughly 33 millimeters as the sweet spot, distribute pressure across the palm instead of concentrating it in the fingers. Long-handled versions of the same tools solve a second problem entirely. Kneeling and bending, which is often more punishing to hips and knees than the gripping ever was to the hands. A long-handled weeder turns a task that used to mean getting down on the ground into one that's done standing upright. And for anyone not ready to buy new tools, the fix can be almost absurdly simple. Pipe insulation wrapped around an existing handle to thicken the grip, or a tennis ball with a slit cut into it slid over a smaller handle. Does much the same thing. The Arthritis Foundation's Ease of Use commendation exists specifically to flag commercial tools that meet this standard, which makes shopping considerably less of a guessing game. The reason this matters for independence specifically is that activities like gardening aren't just physical therapy in disguise, though they are that too. They're one of the last unstructured reasons many older adults go outside, move their bodies, and stay engaged with a daily rhythm. Losing that activity to untreated joint pain often isn't the first domino. It's a late one after months of quiet avoidance. Solving it early keeps the whole structure standing. The same principle scales to every other physical independence intervention you'll hear about. Balance work, strength maintenance, mobility routines. None of them require dramatic effort. They require removing the small mechanical barriers that make the activity painful, so the body keeps doing what bodies are built to do: move daily without asking permission first. None of these three pillars, the house, the money, the body, does much on its own. A perfectly accessible home doesn't help if a medical bill forces a move. A fully funded retirement doesn't help if joint pain keeps someone sealed indoors. A strong, mobile body doesn't help if a nighttime fall happens in a house with no lighting plan. But put them together and something different happens. The house catches problems before they become emergencies. The financial plan absorbs the costs that would otherwise force a hard decision. And the body, kept moving through small, smart adjustments, buys time for both of the other two to keep working. That's the actual blueprint for staying independent. Not one big decision made once, but three ordinary systems, maintained quietly for years, so that the phone call every family eventually dreads never has to happen at all.